Welcome to Problem Solve, the podcast where me and a special co-host solve all your problems really easily, probably.
Problems? Are you kidding me? I don't have any problems. Okay, I might have a few, but I can work on them with you. Come on.
Hello, Dr. Spiegel. How are you doing today?
Hello, Jeff. I'm doing fine. Thank you.
Good. Before we get into the interview, can you introduce yourself to everybody?
I'm Dr. David Spiegel. I'm a Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences at Stanford University School of Medicine. I run the Center on Stress and Health. It's a research program here, and I run the Stanford Center for Integrative Medicine as well.
Mm-hmm. How long have you been at Stanford?
Oh, just 49 years, that's all.
Okay. So a little while, I guess.
A little while, yeah. I'm getting used to the place.
Yeah. How do you like working there?
I love it. I
Do
love
you?
it. Yeah. It's
Yeah.
you can ask any question, find any answer, just get the support to do it and publish papers about it, and people are happy. So it's
Yeah.
been a great place for my career.
That's great. How have you enjoyed working with the students there?
They're terrific. Every one of them is sharp, motivated. They're just terrific students to work with. They soak up knowledge. We say that we have 3 stages of learning. You acquire knowledge, you evaluate knowledge, and you create knowledge. And that's what our students do. And Stanford is a great place to do that.
Yeah. Were they better 49 years ago, or that have they improved over the decades, or are they just a little more annoying these days?
They're the same. I've gotten worse. I think that's no. They're very good. They're smart. They're motivated. They're interested. They think openly, and they're eager to go out in the world and make things better.
Yeah,
and they do. So
good.
It's a real joy to teach here and see patients and do research.
Nice. Yeah, I went to graduate school down in Los Angeles at USC. Are USC and Stanford rivals? Should we not be talking to each other?
Yeah, it's been a pleasure talking with you. No, it's the football team used to be a big rival,
Right.
but all the good football teams decamped to the East Coast here, and so we're no longer football rivals. I guess we are in other ways. They're leading private universities in a state that has really excellent public universities. So in that sense, we are.
Yes. Well, I will continue the interview anyways, even though I do feel a little superior to you.
I'll fix that.
Okay, I'm sure you will. So you focus a lot on hypnosis, is that right?
I do.
Yeah. Why are you so obsessed with it?
It's a family illness, actually. Literally, my parents were both psychiatrists and psychoanalysts, and so they told me I was free to be any kind of psychiatrist I wanted to be, and here I am. Mm-hmm. My father was getting analytic training in 1940. And at the end of one session, his analyst said, Herb, would you like to learn hypnosis? And my father thought, what did I say wrong, that he's making this interpretation? And it turned out that there was a Viennese psychiatrist who had escaped with the Nazi onslaught. And he was a forensic psychiatrist. He had a smallpox scar in the middle of his forehead. And he noticed that when he was interviewing prisoners, some of them would just sort of nod off and go into some kind of altered state. And he discovered that some of them were slipping into a state of hypnosis. So he got interested in it. When he came to the U.S., he wanted to help the war effort. He couldn't enlist in the Army, but he taught Army doctors how to use hypnosis. So my father started using it in combat to help soldiers who were wounded with pain and combat stress reactions. He came back and sort of felt that any good psychoanalyst should do what Freud did, and that is give up hypnosis. But he had the itch to find out how his patients were doing, and he tended to get better responses when he called for follow-up from the patients he'd used hypnosis with than the ones he'd done 3 or 4 days a week psychoanalysis with. And he started doing more hypnosis and less analysis. And the dinner table conversations were pretty interesting. And I got to watch him make movies of some of the patients he was treating with hypnosis. So when I got to medical school, I naturally had to take a hypnosis course. I did. Mm-hmm. And I was still trying to decide what to become, a surgeon, a psychiatrist, whatever. But I followed the family tradition. And my first patient, Jeff, was a 16-year-old in status asthmaticus. The nurse in pediatrics said, your patient's in room 33, see what you can do. And so she's in there, pretty redhead, knuckles white, bolt upright in bed, struggling for breath. And they had tried subcutaneous epinephrine times 2. It didn't work. They were considering general anesthesia and steroids. And I had just gotten out of my course, and I said, you want to learn a breathing exercise? And she nods. So I got her hypnotized, and then I broke into a sweat because we hadn't gotten to asthma in the course yet. And I said something very subtle and clever. I said, each breath you take will be a little deeper and a little easier. And within 15 minutes, she's lying back in bed. She isn't wheezing anymore. Her mother, who was standing next to me, stopped crying. The nurse ran out of the room. My intern came running in looking for me, and I thought he was going to pat me on the back. And he said, you need to know that the nurse has filed a complaint with the nursing supervisor that you violated Massachusetts law by hypnotizing a minor without parental consent.
Oh, wow.
Now, I'm here to tell you that Massachusetts has a lot of strange laws, but that is not one of them. And our mother was standing right next to me when I did it. So he said, you've got to stop doing this. It's dangerous. And I said, you're going to give her general anesthesia and put her on steroids, and my talking to her is dangerous? I don't think so. Right. I said, I'm not going to tell my patient anything I know is not true. So take me off the case if you want, but I'm not going to stop doing this. So he stormed off, and there was a council of war with the chief resident and the attending. And they came back on Monday with a radical idea. They said, why don't we ask the patient? I don't think that had ever been done before. And she said, oh, I like this. So she kept doing it. And she went on. She had been hospitalized every month for 3 months. She had one subsequent hospitalization, but went on to study to be a respiratory therapist. And I thought that anything that could help a patient that much, that fast, and violate a non-existent Massachusetts law had to be worth looking into. So that was the first of about 7,000 people I've used hypnosis with in my career.
Wow.
I just never stopped.
Yeah. It sounds like you kind of stumbled into it and then saw the incredibly powerful effect, and it hooked you
That's
right
right.
away. Yeah.
That's right.
Interesting. Going back a little bit, because you did mention that Freud gave it up. Is it true that he gave it up because his voice was so nasally and whiny and everybody couldn't stand listening to him when he tried to hypnotize you?
Well, I don't know of any audio recordings of Freud, but I don't think that was the reason, frankly. He wrote in his autobiography, he didn't say that much, so patients didn't have a chance. He mostly listened. He wrote in his autobiography that he was relieving a patient of her attacks of pain by tracing them back to their traumatic origins, when suddenly she opened her eyes, and he was using hypnosis then. She opened her eyes, threw her arms around my neck, he said, and he said, I was modest enough not to attribute this event to my own irresistible personal attractiveness. And I discovered the mysterious element beneath hypnosis. The element he discovered was transference, that patients would transfer their feelings about parents, and he had all these theories about early childhood sexuality and all that, onto their therapist. So he said, in order to understand and control this, I had to stop using hypnosis. And he moved. The reason there's a couch in analysis was he had patients on a couch to hypnotize them. He didn't like them staring him in the eye, so he moved his chair behind the couch, and that became the architecture of psychoanalysis. But that was the moment when Freud decided he better give it up and understand rather than utilize these transference feelings.
I see. Interesting. I like to think it's because of his whiny voice, although... it makes sense in the story that you told. And is that when he started to come up with like free association and all that?
That's right. That's exactly right. And he stopped using hypnosis and started using free association. That's correct.
Okay, so let's take a quick second to talk about something we all put off way too often, and that's finding the right doctor. Honestly, it should not feel like a guessing game. That's where ZocDoc comes in, and it is a total lifesaver. ZocDoc is a free app and website where you can search and compare high-quality in-network doctors, find the right one for your needs, and book an appointment instantly. It's super easy to use. You can filter for doctors who take your insurance, are located near you, and specialize in exactly what you're looking for, whether it's mental health, dental health, or something as simple as an eye exam. And the best part, you can actually see their available appointment times and book them instantly. Most appointments happen within just 24 to 72 hours. You can even find same-day slots. And let me tell you, having that level of convenience is a game changer. You're not stuck on hold forever or wasting time searching random reviews online. ZocDoc has more than 100,000 healthcare providers across every specialty, all with verified patient reviews, so you know you're getting the best of the best. I use ZocDoc myself. It has made finding a doctor way less stressful. So if you're tired of putting off those appointments, here is your sign to make it happen. Go to ZocDoc.com/solved to find and book a top-rated doctor today. That is ZocDoc.com/solved, ZocDoc.com/solved. Okay, let's get back to the episode. I've personally tried to get hypnotized maybe 10 or 12 times. It's never actually worked for me. It hasn't been successful. Do you think it's because I'm too smart? I'm too good looking?
Neither of those two.
I've heard that actually makes a pretty big difference. There's also, I don't know if this is like a myth or real. I'm sure you can debunk it. They say that sometimes, like, you can tell somebody is more easily hypnotizable the further they can roll their eyes behind their head. Is that a true thing?
Yes, there is truth to that. And my father is the one who discovered that. He found that. Yeah. He initially would have people look up at a light on the ceiling and have them close their eyes. And he began to notice that one of the patients I had seen him make a movie of, who was extraordinarily hypnotizable and would have go into these states and have these pseudo seizures, where she'd look like she's having an epileptic attack. And you could use hypnosis to gradually teach her to control it. And when she looked up and when she went into one of these states, her eyes rolled way up in the back of her head. All you could see was the whites of her eyes, the sclera. And she was very hypnotizable. The following Monday, he had a really rigid, obsessional guy who he had look up at the ceiling, and he brought his eyes all the way down as he closed them, and he was not even a little bit hypnotizable. So my father started thinking, maybe there's a relationship. And, the eyes are very much related to our levels of consciousness. The obvious thing is when you close your eyes, you usually go to sleep. When you dream, when you shift into dreaming, rapid eye movements. Your eyes are moving back and forth, even though your body is immobilized while you're dreaming. And the third, fourth, and sixth cranial nerve nuclei in the brainstem are surrounded by the reticular activating system, which is an arousal system in the brain. So eye movement and levels of consciousness are very much connected. And there is a rough correlation between the capacity to keep your eyes up while you close them and your ability to experience hypnosis. So I could look at yours if you want. Yeah. Can you look up to your eyebrows? Yeah, look up. And while you keep looking up, close your eyes. Close. Yeah, on a scale of 0 to 4, you're about a 2. You're sort of mid-range. Not 0, but not 4 either. There you go. That's it. There you go. Yeah. So you would probably be somewhat hypnotizable. Yeah.
Somewhat hypnotizable. I would like to be hypnotized. I also maybe haven't been to the best hypnotists in the world. But it is something I'm.
Well, we can give it a try if you want.
Well, before we,
sure,
I do want to try it. But are there any like practices or strategies I could do to like be more hypnotizable just in my everyday life?
In general, it has more to do, Jeff, with using it consistent with your level of hypnotizability. That's much more effective. In general, hypnotizability in adult life is as stable as IQ. It just doesn't change very much. Now, we've recently published a study in which we use transcranial magnetic stimulation, which is now used to treat depression. Put a magnet in a specific place near the dorsolateral prefrontal cortex that suppresses activity in the dorsal anterior cingulate, where we have found using MRI, activity decreases when you go into a state of hypnosis. So, and we found that we could transiently improve hypnotizability, but that's a big fancy machine that you don't carry around in your pocket. So probably not. Probably to benefit from it, you would do best if you figured out how hypnotizable you are and then used your degree of hypnotizability as a guide to how to deal with whatever problem it is you wanted to deal with.
Interesting. Okay, so is it more just kind of purely biological? Depending, that's what. Yeah. Okay.
Well, there's two parts to it. One part is biological, and that is there's a particular gene polymorphism in the catechol-O-methyltransferase gene, which helps to metabolize dopamine. Dopamine is the most popular neurotransmitter in the brain. It's the one that makes you feel good when you get high and things like that.
Big fan.
And my colleague Anna Lemke, who deals with addiction, wrote a book called Dopamine Nation about how much we're in pursuit of that. If you have a particular type of polymorphism in that gene, methionine and valine, you metabolize dopamine at about the right level to keep it relatively high. Not too little, so you don't produce enough, not too fast, so you metabolize it away. And we found that people with that particular polymorphism are more hypnotizable, and we actually developed a genetic test you could do at the bedside to find out if you have that. But in general, it's not very changeable in adult life. However, all 8-year-olds are in trances all the time. You ask your kid to come in for dinner, he doesn't hear you, he's out playing on the street. Work and play are all the same thing. And I think it's kind of a shame that we try to make children who have this wonderful engagement absorption in their life into little adults too early, because what happens as you mature in adolescence into adulthood, where you start to value reason more and experience less, you lose some of your hypnotizability. And some lose more than others. But and the other thing that can lead to higher hypnotizability in adult life, there's a good path and a bad path. The good path is imaginative involvements. Your parents read you bedtime stories. You use your imagination a lot. You love drawing things and all that. The bad path, unfortunately, is children who are mistreated or abused tend to use the hypnotic state to detach themselves, to dissociate. And I had a patient who said, I went to a mountain meadow full of wildflowers when my father was abusing me. So if you have it there as a kind of necessary defense against mistreatment, you tend to be more hypnotizability as an adult. Or if you use it for enjoyment, you tend to retain more of your hypnotizability as you grow up.
Okay, so if you dissociated in response to some traumas or abuse when you were a kid, then there's kind of like a link to that feeling that if you do go into that space, you're unsafe, and that's why it's harder to get them to go there?
No, it's the other way around.
Sorry.
It's an interesting explanation, but it's more like this is a place where I can go to feel as safe as I can feel. It's happening to my body, but not to me. And so they retain that ability because for them, it's an emotional protection from bad experiences.
Interesting. Huh. And you were saying that like most children, 8-year-old children, they sort of have this natural ability to fall into hypnosis, but as they mature, become adolescents, then they're affected by whatever, society, our parents, school, where we value reasoning and logic. So it forces them to kind of operate in a certain part of their brain that maybe isn't it's not hanging out in like a hypnosis sort of center.
That's right. I mean, you couldn't tell that adults value reasoning and logic by what's going on in the world at the moment, but in principle, you're right.
Yeah, right, exactly. So do you sometimes use hypnosis to address things like anxiety or panic disorders?
Absolutely. We do that all the
Yeah.
time. We teach people, and we do it in a way that's different from traditional psychotherapy and certainly does not involve medication. We do it from the body up. So if you're anxious about something and you want help with it, what I have you do is learn how to go into a state of self-hypnosis and make your body comfortable. So imagine you're floating in a bath, a lake, a hot tub, or just floating in space. And you start to feel the way your body feels when they're in that state. Your brain retains memories of how it was acting and arranged when you were in a state like that. And we also teach people how to breathe in a way that tends to help induce relaxation, short inhales and nice slow exhales through your mouth. And then once you've gotten your body comfortable, you've already dealt with half the problem, because when people are anxious, what do you notice in your own body when you're anxious?
Yeah, my heart beats real fast. I become overheated. There's a tightness in my chest.
Beautifully described. And what happens to your brain when you notice that that's happening in your body?
Yeah, I mean, it gets hijacked, and there's like fear and I need to make a decision now, and it's hard to think practically and logically. Yeah,
and then your body reacts to that, so it's like a snowball rolling downhill. It gets worse and worse. So what we do with hypnosis is we start with the body first. The one thing you can control about a stressor is how your body is reacting to it. So do that first. So you get your body floating in a bath, a lake, a hot tub, or floating in space. And then I have you picture in your mind's eye an imaginary screen. And on the left side, picture one thing you're anxious about, just one. But maintain your comfort in your body. And on the other side of the screen, picture one thing you can do about it. So you're now in a situation where your body's feeling better. You don't have that feedback. You've narrowed the range of problems to one, which is more manageable, and you're starting to think about what you can do about it. And so that's the way we use hypnosis. And we're finding among thousands of users of our Reverie self-hypnosis app that within 10 minutes, they get a 20% reduction in the level of stress that they're feeling. So they can immediately find a way. 4 out of 5 of our users improve within 10 minutes. And so it's a powerful way of gaining control over your body and your mind.
I mean, it sounds like, a lot of it is sort of regulating the nervous system, right? Maybe slowing down your heart rate, or
you bet.
Providing more oxygen to your brain.
You're right. But that's what our brain's there for.
Right. I feel like, could somebody who's really good at mindfulness techniques do this without hypnotism, or is it just easier to do with hypnotism? What's the difference there?
Well, I think it's faster. The difference is mindfulness is meant to be a kind of regular practice. It's like taking a vitamin every day, to have open presence, to just be open to whatever you're feeling, to do a body scan to check what's going on in your body, and to feel compassion for others. That's a great thing. But it's not meant to solve an immediate problem. It's meant to more change your way of being. And so you're meant to quiet the mind, to not panic and fight back if something unpleasant is happening, to just watch it flow by and flow through you. Hypnosis involves turning down the sort of alarm system in the brain, saying, oh my God, what's going on? Get your body more comfortable and exert control on how your body and your mind are reacting to a stress. So they're related, but they're not the same. They both do have similar but not identical effects in the brain. In both, there's some reduction in activity in what's called the default mode network in the back of the brain, but more acutely with hypnosis than with mindfulness. So they're similar, but they aren't the same, and we use them differently. So I'm not in building the Reverie app and teaching people how to use, thousands of people how to use hypnosis. My goal is not to have a bunch of hypnotized people walking around all the time. So I don't make them hypnotize folks the way mindfulness makes people meditators. I just want them to have it as a tool to use when they need it.
And is it a tool that they sort of reach back into their mind and deliberately use it, or is it something that's kind of like get set as a new default so that when you do experience anxiety, you're not as hijacked by it?
Eventually, that's what we hope happens. But
Okay.
the main teaching is to have it as a tool. Say, okay, I know this is like people who have airplane phobias. We in the app, we have a program for that. And there are 3 things I teach people to do. Float with the plane. Don't physically fight the plane. Buckle your seatbelt and float with the plane. Then think of the plane as an extension of your body. You're like a bicycle. You want to get from one place to another faster, you get on a bicycle. Faster than that, get in a car. You get in the plane, the pilot is your proxy for controlling the plane safely. And you think about the difference between a possibility and a probability. The plane might crash, but it's not very likely. So I want it to be available as a tool for people when they need it. Now, eventually, as people learn to do that over time, they may do a lot of that more automatically. Oh, yeah, I remember what this is like. My body floats with the plane and so on. But I see it more as a tool to be used than kind of it. Eventually you may be reprogramming the brain, neurons that fire together or wire together. Right. But at first it's just a technique that you have available to use when you need it.
And it's something that you're going to have to use a decent amount of time so that you can probably get used to it and experience the benefits of it. And if you don't use it, you sort of lose it, kind of thing.
Well, it can be, but frankly, it doesn't take very long. You can feel it right away. And so, by and large, when people feel good about it, they just do it. There are times when you've sort of solved the problem, like people use it to stop smoking. Right. And we're finding in Reverie that 1 out of 4 people stop smoking, and the remainder cut their daily cigarette use by 50%. Now, after a while, you don't have to think about respecting and protecting your body from the poison of cigarette smoke. But initially, you have to practice it. Once you've decided, I've had it with cigarettes, you're done. You don't have to do that anymore.
That makes sense. I used to smoke cigarettes, and I looked very cool. And so I didn't want to lose that cool factor. And I smoked for 15 years.
Oh, my goodness.
But I stopped.
How did you stop?
I stopped 13, 14 years ago.
Good for you.
Part of the reason I stopped was because when I was smoking, it started to really, I would get a headache instantly and my nose would start running. It felt like my body was like, we're done with this. Can we please put it? So that created some motivation that hadn't been there before. But then I read that book, the book, probably The Easy Way to Quit Smoking by, what's his name? Oh God! It's a very poorly written book, and it's very repetitive. It's very short, and he just convinces you how disgusting it is to put a cigarette into your mouth, and he's just like, taste it, taste how gross that is, actually. So it sort of convinces you to pay attention to those things.
Well, that's not our approach to it. We focus with hypnosis. The thing to do is to focus on what you're for, and what you're for is not cigarettes tasting bad, which they do, but it's for respecting and protecting your body. Would you ever put into your baby's lungs or your dog's lungs what you're putting into your body's lungs? It's hot smoke laced with tar and nicotine. No. So think about respecting and protecting your body. For my body, smoking is a poison. I need my body to live. I owe my body respect and protection. So you're reconstructing your relationship to your body. And it's a weird thing. We will do to our own bodies things that we would never do to any other creature. And if you think of it that way, the only logical thing to do is protect your body from the poison of cigarette smoke.
Sure. That makes sense. I feel like, I'm on board with hypnosis already, but I can really easily understand how hypnosis treats, smoking cessation, maybe the fear of public speaking, like these very specific anxieties that are happening. But it's also helpful with like trauma and PTSD work, right? How does it apply to that sort of stuff?
Well, one of the things that happens in hypnosis, the thing that scares people the most, Jeff, is this idea of losing control.
Right.
I went to Las Vegas and I saw a show where the hypnotist made the football coach dance like a ballerina, and it sounds scary, but you know what? Hypnosis is really a way of trying out being different. And if you're a football coach and want to be a ballerina, that would be a way to start. But that's not what we do. It enables you to see yourself from a different point of view, because in hypnosis, you can turn down activity in the default mode network. It's a part of the brain where when you're not doing anything else, you think about who you are and what you're becoming and what people think of you and what your mother wanted you to be and all that. I call it the my fault mode network. And you can just turn down activity there. It's also a part of the brain where activity is turned down by psychedelics, that you just you dissolve. They call it self-dissolution in psychedelic speak, but I call it self-suspension. You try out being different. And people suffer from trauma with a lasting horrible imprint of the experience. That is, the worst thing about trauma isn't fear, it isn't pain, it's the loss of agency, it's being helpless. We hate being helpless. And so what many people who have suffered trauma and who have post-traumatic stress disorder have is this terrible, inappropriate guilt. They blame themselves for events they didn't control. Why did I go to the grocery store at 3 o'clock in the afternoon through the park, and this guy jumped me, as if you could have known that was going to happen.
Right.
I've had a patient who for 30 years was depressed. She had been sexually assaulted as a young girl by the family's landlord, and the family was afraid to do anything about it. And I had her go back in hypnosis, get your body is safe and comfortable now, keep your body floating, but I want you to picture yourself after this guy attacked you. And she starts to cry. And I said, I want you to picture, you be your own mother. I want you to picture yourself as that little girl, but you're the age you are now. And I asked her, I want you to look at yourself as a little girl and answer one question for me. Is this her fault? And she started to cry harder, and she said, I'm stroking her hair. I'm stroking her hair. And she had this sudden realization that it could not have been her fault, but she was living as if it were. And she called me about a week later, and she said, Dr. Spiegel, my doctor wants to know what you did to me because I'm not depressed anymore.
Wow.
And she said, my friends don't recognize me. I'm a different person. So the cool thing about hypnosis is you can try out being different. And if the shoe fits, wear it. If it feels better, if it makes sense, you can really be different. And you don't have to do a long process of thinking your way through it. Sometimes that's necessary, but sometimes it isn't. You can just get it and feel it emotionally and see yourself differently than you did before.
I mean, is a story like this more of like a one-off sort of experience where it was like this incredibly powerful session that created lasting effects? Or is it typically we're in this for the long term, 6 months, a year?
It can be either one, and I've done both with people. The people with more severe continuing trauma tend to need more severe continuing psychotherapy. But sometimes it can just be a session or two that helps people put themselves together in a different way. Sometimes they need more supportive psychotherapy. There are some times when I've worked with people for years in dealing with trauma like that. So it doesn't always work that way, but at the least it gets them on a different path that can be very helpful.
Yeah. I think, part of the problem, part of the issue that maybe it could be a little tricky to hypnotize me is that, here I live in Oregon, in Portland, Oregon, and, we're allowed to do like the psilocybin treatments now. And I've gotten to do a couple with some people that have, been trained and licensed up here with like fellow therapists and psychologists. And whenever I do anything like that and I, eat the mushrooms, I'm automatically fighting it. It just feels like there's this tension between me, who wants to have complete control, and the psilocybin who's just like, hey babe, let's go on this journey. Like there's a gondola, there's a river, there's fractal like designed cities, and it's trying to get me to go, over here on this path, and I'm doing everything I can to not allow it to do that. And I've tried to work through it and figure it out and be more open to being influenced by these, the wise mushrooms, but it doesn't work out. And it feels like it's sort of a similar-ish process where if somebody's trying to hypnotize me, I'm just like, I'm actually going to sabotage this, and this isn't going to work at all, because it feels like a lack of control. And my complete control that I always tried to have in childhood was really served me and protected me and got me through tough times, right? So for whatever, if it's mushrooms or if it's hypnotism, there's just like, I really have to be able to let go and trust it or trust the practitioner, and I just haven't been able to do that. Is there something, have you experienced that sort of thing?
Yeah, there are people like that. But if you like, we can try it. See how hypnotizable you are on this standard measure, the hypnotic induction profile, and I can speak more knowledgeably about where I think you are. Because, yes, I doubt that you're extremely hypnotizable, but it's a matter of whether you're not at all, or you're one of those people that can sort of dip your toe in the water, get a feeling for what it's like, and then pull back and wonder about it. And it sounds like you might be in that domain too.
Yeah, I could be.
Yeah.
There's even like resistance to like messing around with it with you right now. There's just like there's just sort of like this fear or like little bit of anxiety that comes up, where she's like, yeah, do I really want to do that?
Sure. Well, I understand that you can feel vulnerable, but you could learn something too.
Yeah. Well, okay, then let's go for it.
Okay, good.
What do I have to do here?
Get as comfortable as you can. You're in a chair. Do you have armrest on the chair there?
I don't have armrest.
All right.
On the
Well,
chair.
you can rest your arms on the desk in front of you or something like that, or on your legs, whatever's easier for you. Okay. So I'm just going to give you some instructions about your eyes. And are you right or left-handed?
I'm right-handed.
Right-handed. So your left-handed arm, I'm going to give you some instructions about that. So get as comfortable as you can. Look straight ahead. And now look up to the top of your head, all the way up high as you can. Way up. And as you keep looking up, slowly close your eyes. Close. Keep looking up if you can. Try it again. Look up past your eyebrows. Now keep your eyes up while you close your eyelids. Close. Good. All right. Take a deep breath. Let the breath out slowly through your mouth. Let your eyes relax, but keep them closed, and let your body float. Just imagine your body is floating somewhere safe and comfortable, like a bath, a lake, a hot tub, or floating in space. And I'm going to ask you now to take your right hand and let it float over and stroke the back of your left middle finger. So let your right hand do that, and all the way down along past the back of your hand, past your wrist to your left elbow. And as you do that, that's it. Stroke backwards down toward your elbow. Develop a sense of tingling and numbness and lightness. And let your left hand float up in the air like a balloon. That's good. You can stop stroking it now and just let your left hand float up into the air like a balloon. Higher and higher. That's good, as the rest of your body feels heavy and relaxed. If you want, you can bend your elbow and let the upper arm rest against your body, and your left hand float up in the air, straight up in the air. That's good. Now I'm going to give you this instruction. Your hand will remain light and in this upright position even after I give you the signal for your eyes to open. Later, when I ask you to pull your left hand down with your right hand and then let go, your left hand and arm will float right back up to the upright position. You'll find something pleasant and amusing about this sensation. After that, when I ask you to touch your left elbow with your right hand, your usual sensation and control will return. Each time you go into this state of concentration, you'll find it easier and easier to do, and you can use it to help you concentrate on what's important to you. Right now, we'll come out of the state of concentration together by counting backwards from 3 to 1. On 3, you'll get ready. On 2, with your eyelids closed, roll up your eyes, and 1, let your eyes open. Ready? 3, 2, 1. Good. Now stay in this position, please, and describe what physical sensations you're aware of now in your left hand and arm.
It does feel a little tingly.
A little tingly? Good. Is it comfortable?
It's not super comfortable. It feels a little heavy.
Does your left hand feel as if it's not as much a part of your body as your right hand?
No, it feels like it's a part of my body.
Does your left hand feel as connected to the wrist as your right hand feels connected to the wrist?
It feels a little more disconnected.
A little more disconnected. Okay. Now, please take your right hand, pull your left hand down, and then let go. All right. Now let go. You look a little surprised.
Yeah, I am surprised.
Yeah. So,
I mean, because while you were doing that, I was also like very doubtful.
That's
Yeah.
it.
Yeah.
Okay. But you surprised yourself, even though you were doubtful.
Mm-hmm.
Did I do or say anything that would indicate there'd be a change in sensation or control in your left hand and arm?
Did you say or indicate?
Yeah.
No.
Well, why did you get the control back?
Oh, well, no. You told me that once I touched my elbow, then I would, yeah.
And did I touch your elbow?
I touched my elbow.
Yes. Did you have a sense of floating lightness or buoyancy in your left hand and arm during the test?
I did.
Did you have that sense in any other part of your body? Head, neck, thighs, abdomen, chest, all over, or just your left hand and arm?
It was just my left hand and arm.
Okay.
Yeah.
So you are moderately hypnotizable. Your
Okay.
score is 6 out of 10, which doesn't surprise me. And it's exactly what I thought might be happening, which is that you have a capacity for this, but then you step back and reflect on it and say, wait a minute, is this really happening? What's going on? So it's not that you don't judge and evaluate, but your brain was able to go ahead and do it despite your doubts. And so you kind of surprised yourself. So you're a good mid-range hypnotizable person. We call them the diplomats. And you can use it to help yourself with a lot of problems. You can let yourself go, let yourself have the experience, but then step back and wonder what it's about. So despite your initial skepticism, you were able to see what it's like to change the way your body feels. Could you say a little more about what your experience was like?
Yeah, I mean, it was easy to follow your instructions. And even though there was like this feeling of doubt and also kind of like being put, like there was like, I felt like there was a spotlight on me. Like I don't want to disappoint you or my audience or something. That was like kind of in the background.
Sure.
But just sort of like doing the very simple things that you asked me to do were like very manageable, and I was like open to something that could happen.
That's great. But to actually do them, it didn't feel effortful, did it? It was like you were discovering something. Is that right?
Yeah, I was discovering that maybe there was like a part of me that could let go and trust the process a little bit, and it didn't feel like there was a ton of effort on my end.
That's great. So that's the way in which people with hypnosis can surprise themselves. You know, you can do things you didn't think you could do. You know, this was a little different from what your expectation was about what would happen.
Yeah.
And so, yes, there's a part of you that probably fought it a little, but there's a part of you that let go and experienced it, saw what it was like. Yeah. And so that's typical of mid-range people, mid-range and hypnotizability, and you are.
Great. Well, that's good to know. Thank you for that. Are there very like similar sort of practices in the Reverie app that people can do on themselves to get this
exactly
sort of
like.
Yeah. Okay.
On the Reverie app, you get to hear my mellifluous voice anytime you want. And it's interactive. So I'll ask you the way I did here is your hand floating up in the air. And we have the test on the app. And if you say yes, we'll go on to something else. If not, I'll give you another reinforcement to do that. So it's as much like being in my office with me as we can make it.
Mm-hmm.
And so you can have a similar kind of experience just going to Reverie and using the app.
My final question is like, has there been any pushback from the medical field when it comes to like, apps like this, like Reverie, that are introducing more like hypnosis?
I'll tell you, Jeff, if I tried to do this 40 years ago when I was starting my career,
Mm-hmm.
I wouldn't be in my career. People would say it was too dangerous. In fact, you're going to love this. 100 years ago, when automobiles were invented, a number of states passed laws against windshield wipers.
Oh, really?
Well, yeah, and you went, what? What's that about?
What? Yeah.
What's the oldest image of a doctor hypnotizing someone?
Sure, the
dangling watch,
yeah.
dangling watch. So people thought that the drivers would be going left to right, looking at the windshield wipers instead of the road,
Mm-hmm.
and that hasn't happened, and the laws are gone.
Mm-hmm.
So it's something that we worried about a lot more then, and now, I recommend that people who are getting treatment, who are being diagnosed and assessed, and are getting treatment for hypnosis, using hypnosis. Will go to a licensed and trained professional, physician,
Mm-hmm.
psychologist, dentist, if you're getting it for dental pain. But we have had 850,000 downloads with Reverie. We've had, right now there are 27,000 people enrolled in the system, and the number of problems and complaints we've had is less than 10.
Wow.
One person had said her headache got worse instead of better. Another one said her hand felt funny for a little while after the thing was over. And
Mm-hmm.
one woman said that she found herself out on her patio having sexual feelings throughout her body, which I'm not sure I would count as a problem. But we've had very little difficulty. So I was worried about it at first,
Mm-hmm.
but our experience is that people use it. Often 4 out of 5 times they feel better right away, and they
Mm-hmm.
benefit from it. And if you compare that to the fact that last year alone, 88,000 Americans died of opioid overdoses in the United States,
Mm-hmm.
You tell me which one is dangerous.
Right.
Opioids are dangerous. Hypnosis is not.
Mm-hmm. Okay. Well, this has been a really fascinating conversation. You're incredibly smart, a really good storyteller.
Thank you.
I've really enjoyed our talk and the experience of being hypnotized. That was really fun.
Cool.
And enlightening. If people want to like learn more about you and everything
Sure.
you're offering, where can they find the information?
www.reverie.com. The website has all kinds of information about hypnosis, about me, about what we do. You can download the app from the website, or you can go to the App Store for iPhones and Google Play for Androids and download it there.
Great. Okay. Well, we'll link to all of those things in our show
Terrific.
notes. And it's been a pleasure chatting with you.
Likewise, it has
Yeah.
for me too. Thanks so much.